In this video, I'm going to show you two powerful strategies that will help you get rid of knee stiffness for good. Let's get started. Welcome back, guys. This is Dr. Mike, physical therapist. Now, if you're someone that is dealing with knee stiffness, maybe you're someone that is having trouble restoring your knee flexion after a surgery, particularly maybe after knee replacement surgery, I'm going to teach you two strategies that you can use to help restore the flexibility in your knee. Now, many of you who are going through this type of condition have probably been taught the heel slide exercise. Now, although this is a great exercise to help restore knee flexion, sometimes we're gonna need a little bit more to help improve the flexibility of the knee. Now, the first strategy that I wanted to teach you is by simply working on some soft tissue work, but at end range. So what that means is if you're working on stretching here, you're gonna pull your knee or slide your knee as high as you can go until you really can't pull that knee any further. Now, what you can do using myofascial release or soft tissue release now, specifically in the quads, because this is commonly the area that is gonna limit your knee from moving further, you can start to kind of work in some of this soft tissue along the quad. Where you'll typically have more tenderness or tightness is along the top of the kneecap here. You want to be very careful if you're new to the surgery. You do have that incision coming down the top there, so be very careful on applying pressure over that incision, especially if you're a couple, maybe 2 or 3 weeks post-op. But if you're outside that window, you can surely start to use your fingertips, and I use kind of what we call like a lumbrical grip, and I'm kind of pulling the skin towards me, and that's going to allow you to really get some nice soft tissue work along the quadricep. Now, you're working on this as your knee is at that end range, so after about a few minutes, now you can slowly see if you can pull that heel any further, which after a few minutes, you should be able to restore a little bit more range of motion. Once again, you can also work on more soft tissue along the quadricep area, inside, more even on the outside. And then after that work is done, see if you can move and slide that leg a little further. You're gonna have some good results using this technique. Now, the second strategy that you can use is simply working on passive range of motion. Now, passive range of motion is when we use our hands or when we use an external piece of equipment, maybe like a yoga strap or something else helping us and assisting us through that range of motion that we wouldn't be able to achieve without that equipment. So when you're working on this passive range of motion, one of the most effective ways that I like to teach my patients is by simply hooking both of their hands right here over below the kneecap. And that's specifically important because now what we're trying to do is create a posterior translation of the tibia. That sounds crazy, but essentially, in order to increase knee flexion, that tibia bone needs to be able to glide downward. So when you're working on this, if you're gonna provide a force, you want it to kind of pull down towards your leg there, and you're gonna start to feel some stiffness. It may feel very difficult to work on, but all you gotta do is work on some gentle pressure over the top of the knee there. Once again, after you're done with a couple of maybe 10 to 20 reps, you can work on sliding that heel even further back and still working on that. Now, if it's too difficult for you to actually use your hands, this is where a yoga strap, something like this, can really help, because now you have more leverage and you can, once again, place it below the kneecap, just right there on the tibia here. And once again, I'm pulling in this diagonal direction, pulling downward, really trying to get some nice, gentle mobilizations of that tibia to help increase your ability to flex your knee there, okay? After you work on this for about 2 minutes with these techniques, you're always gonna wanna test it and see, can you move that knee even further? And you're gonna realize that these are gonna be effective for you to continue to use 8 to 12 weeks, even past that 12 weeks marks, if you're someone dealing with knee stiffness. Now, give these two strategies a try. Let me know how this goes in the comments below. Hope you found this video helpful, and if you want more information on how to recover after knee surgery, take a look at the playlist I made up here. In the meantime, I'll see you in the next one.